Now, welcome to The Big Story. I'm Dylan Ang, coming to you live from the Straits Times newsroom. This just in, the Multi-Ministry Coronavirus Task Force confirmed 9 more cases in Singapore, bringing the total number of cases here to 67. Now, 6 of these 9 new cases are linked to the established cluster of the Grace Assembly of God Church. There are now 13 patients linked to the church, making it the largest cluster in Singapore. The task force also announced additional preemptive measures to reduce the risk of community transmission. These include the reactivation of public health preparedness clinics and 5-day MCs for those with respiratory illnesses. Health Minister Gan Kim Yong expressed concern over Singaporeans who ignore their respiratory symptoms, resulting in further community spread.
We are quite concerned that many of our local confirmed cases had remained in the community, and some have gone back to work even when they were ill, and even after they had seen a doctor. This is not helpful in our efforts to reduce the risk of community transmission. It is a fact that most patients with respiratory symptoms are not infected with COVID-19. But as an added precautionary measure, the Ministry of Health has given guidance to doctors to provide medical certificates of up to 5 days for patients with respiratory symptoms to stay home so that they can recover, rest and recover. We urge our employers to support our efforts and play their part to stop unwell employees from reporting to work.
Now, National Development Minister Lawrence Wong said the nature of the coronavirus is different from SARS based on emerging trends in China and around the world, as well as research that various experts have done.
It is different in several ways. First, the transmission mechanism of COVID-19 is different from SARS. In fact, the transmission mechanism is closer to H1N1 or influenza. And our own researchers, our own people at the National Center for Infectious Diseases, looking at the cases within Singapore, have confirmed this. Because like influenza, they have found that COVID-19 is infectious when the symptoms are mild. So this, and because of this, because of this transmission mechanism, it is also the case that COVID-19, like influenza, can spread quite quickly. The second point is that in terms of severity, COVID-19 is also different from SARS, and we've said that before. If you look at the mortality rate in China, overall it is lower than SARS. Outside of Hubei province in China, it is even lower. Outside of China, it is low too. So mortality rates are lower than SARS. If you look at the severity of the disease, various studies are being done now, but the WHO has a very comprehensive one of 17,000 patients, and they found that 80% of the patients have mild symptoms, 82% have mild symptoms, 15% have severe symptoms, and 3% have critical symptoms.
Now, multimedia journalist Renee Poh is standing by at the Ministry of Communications and Information. Renee, help us unpack what we learned today. 9 new cases with 6 linked to the Grace Assembly of God cluster. What else was said about the new cases?
About the new cases, but with 6 new cases, the Grace Assembly of God is now the biggest cluster in Singapore with 13 cases. So the other 4 clusters include the Yong Tai Hang Medical Shop, the Grand Hyatt Business Meeting, the Life Church and Missions in Paya Lebar, and the work site in Seletar Aerospace Heights. So now there are a total of 67 confirmed cases in Singapore. So 2 cases have been discharged, although we don't know the details of these cases yet, but more will be released later tonight. And 6 cases are still in critical condition and remain in the ICU. Now, Minister Gan Kim Yong said there are no plans for Singapore as of yet to move the DORSCON alert from orange to red.
Now, Renee, Minister for National Development Lawrence Wong said the nature of the coronavirus disease, or COVID-19, has become clearer, that it's different from SARS and closer to H1N1. Can you elaborate?
Yes, so I think you heard from Minister Lawrence Wong just now. So he's first said that COVID-19 is infectious when the symptoms are mild, much like H1N1. So this causes people to let their guard down and continue going out when their symptoms are mild, and that's how the virus actually spreads quickly. And second, in terms of severity, the mortality rate of COVID-19 is actually lower than SARS. So he cited a study of 17,000 patients which showed that 82% of patients have mild symptoms and only 3% have critical symptoms. So because of this higher degree of infection, experts have projected it may spread at a faster rate. And Minister Lawrence Wong said Singapore should be prepared for wider transmission around the world.
Right. Now, Renee, the multi-ministry task force announced that additional preemptive measures will be put in place to reduce the risk of community spread. Now, earlier I mentioned extended MCs and reactivation of the public health preparedness clinics. What other details did the task force have?
So these public health preparedness clinics, also known as PHPCs, they will be activated to care for those with respiratory symptoms. So these include things like cough, flu, runny nose, or fever. And the task force also recommended a 5-day MC to be given to those with these symptoms. This is because those who normally display these symptoms are expected to recover within 3 to 4 days. And these patients will actually also enjoy subsidies at PHPCs and polyclinics. So Singapore citizens and permanent residents will pay $10 for consultation and treatment. And Pioneer and Merdeka generation seniors will pay $5. So if someone is still ill after 5 days, they will be referred for further medical assessment and tests. And if they still display further symptoms, they will be referred to they're advised to return to the doctor for further treatment.
Now, Renee, on a final note, just a final question. You know, Singapore has 900 GP clinics designated as public health preparedness clinics or PHPCs. Now they will be progressively activated from the 18th of January, now which is next Tuesday. Now give us some background, Renee. You know, what is the role of these PHPCs and how do they differ from regular GP clinics?
So these PHPCs, they actually provide subsidized treatment, investigations and medications during outbreaks. And previously they were actually activated during the haze and the H1N1 outbreak. And GPs at these clinics will be guided on appropriate care protocols for each patient, so they are better equipped and trained to manage these cases. And they are also supplied with the necessary personal protective equipment. So how the public will actually identify these PHPCs is that these clinics will have a PHPC decal on them. And they can also refer to the website flugoware.gov.sg for which clinics are actually identified as PHPC clinics.
Well, thanks so much for that, Renee. That was, of course, multimedia journalist Renee Poh reporting live from the National Press Centre at the Ministry of Communications and Information. Now, the Multi-Ministry Coronavirus Task Force has also apologies. Now, meanwhile, the Roman Catholic Archdiocese of Singapore has suspended all masses on weekdays and weekends indefinitely, this with effect from tomorrow. Now, I'm Dylan Ang. Thanks for watching. Good night.